Well, this happens to be the last weekend of Women's History Month, and we'd like to take some time to highlight someone who is making some history right here in our community. She started a Minneapolis-based nonprofit that works to provide services and empower Somali and other East African women and their children. And together they are doing some impressive things here in the Metro and beyond. Joining me now is Fartun Weli, CEO of the nonprofit Isuroon. Thank you so much for joining us this Saturday morning.
Good morning, Leah. Thanks for having me.
So you're doing all sorts of things. We're going to try to get through as many as we can, but talk about the overall goals and the inspiration behind Isuroon.
Isuroon means women who take care of herself. That's what it means. And our goal is to utilize all the strengths that we know Somali women and all women have. But when they're new and moving into new country, all people can see their deficit. So Isuroon is owned, run, and is relevant by women that we serve our community. And our bottom line goal is to get them off the poverty conveyor belt that people who are new can be on and don't really have a way of getting off.
And how many partners do you have? How many volunteers? How many people are you working with on a given basis?
Yeah, so I don't think I'm not going to take the credit. I could be the one who started, but we have amazing volunteers. We have about 25 staff. Any quarter given, we have 8 or 9 intern volunteers from different universities. And we have amazing volunteers from the board, from regular community folks that support us. So I'm not able to take the credit at all. It's not me.
Yeah,
and also serve.
Yeah, very humble, a team effort, right? Which I think we all can appreciate that. Talk about one of your recent events, really focusing on maternal health and doulas. Tell us about that event.
Yep, in our state, however health is, everyone is doing well. We know that women of color and indigenous women have the lowest healthcare access and also health disparity, they call it. Every couple of years, new word comes up describing the disparity of women of color and indigenous women. The idea of women not utilizing the preventative care access and infant mortality rate and cancer and all that is due to lack of cultural understanding. So doula is not something new. It's something that African American women had used it for years before racism and everything else destroyed. So what we're doing right now is really using the solutions that our communities know and working with Somali doulas and training them. And this is the first time ever we have done in our state in addressing women's reproductive health issues, maternal child health, depression, reproductive health access of any kind. And our goal is to both employ the asset and the strength that Somali women and other women have that right now are unutilized because what we deem standard of healthcare worker does not fit what our community that's needed. So doulas are right now the first goal of Bush Innovation Grant that we had last 2 years, its first initial in working with Somali women and getting them early intervention of as soon as she's pregnant. And this woman works with her all the way after labor and delivery and increase the reproductive health services of our state and hopefully reduce the infant mortality rate and maternal health issues of our women.
We're running out of time, but that's one example. You're also working with Afghan families resettling in Minnesota as well, correct?
We are, and we're just giving back. They're amazing, and we're just giving back what we know. Once the resettlement frenzy ends, these communities have strength and mom and dad households. So we're here to give back.
And where can people go if they would like to get involved?
Just go isuroon.org. We're open, and follow us on social media and give us a call or stop by.
There we go. All right, Fartun Weli, CEO of Isuroon. Thank you so much. We appreciate all the good work that you're doing in our community.
Thanks, Leah. Thanks for having me.
Our pleasure.